Hello, this is Siddharth Damber, Chicago Arthritis and Regenerative Medicine. So I want to talk about how what we do in regenerative medicine may differ compared to other clinics that you may be aware of. So regenerative medicine is considered a newer specialty and treatment approach for most physicians. The reality is that it's actually not that new. Number one, prolotherapy is probably the original regenerative medicine treatment and has been around for decades. In addition, there is actually very good data of the effectiveness of bone marrow-derived stem cell treatments in orthopedics since the mid-90s. The Regenix Clinic itself in Colorado started utilizing stem cell treatments in the United States back in 2005. For me personally, I've been involved in regenerative medicine and treating patients since 2008 when I started my own clinic. So while it's a newer specialty, the reality is that there's actually data that goes back not only over a decade, even over 20 years. And so it may be newer for some people, but for those of us that have been involved for some time now, it's a relatively, it's a field that's got some good data behind it and very good experience behind it as well. And as someone who's been treating patients since 2008 and has treated thousands of patients, I can tell you that it's beyond just a new field. It's actually one that is fairly well established at this point, even though it's still growing and we're still learning. So I think there's plenty of other clinics that where physicians are offering good care. However, it's important to understand that there are a number of things that we do that may be different than what you can receive from other clinics. First and foremost is the concept of expertise and focus when it comes to regenerative medicine. As someone who's been doing this since 2008, I can tell you that the manner in which I treat patients at this point in my career, with the experience that I've had, is much different than the first few years when I was still learning how to be a specialist in regenerative medicine. In addition, having a focus on regenerative medicine makes a big difference. There are clinics where they may be utilizing some of these treatments as an add-on or as a secondary treatment if you failed other treatments. In my opinion, these treatments really should be first line for the vast majority of orthopedic issues, with a few exceptions when things may be a bit too severe. In addition, there are certain treatments that I will actually avoid when it comes to orthopedic care. And unfortunately, these still may be utilized as first-line treatments by a lot of physicians. So that would include things like steroid injections, which we know if you're utilizing for osteoarthritis and tendonitis and acute injuries or back pain, can actually be counterproductive long-term. If you give it too many times, it may actually degrade tissue as well. Another common treatment that's utilized for not only arthritis, but certainly back pain, are nerve block treatments. And frequently it's utilizing steroids and local anesthetic injections, and sometimes even burning those nerves. The issue there is that while a local nerve block may help with pain short-term, there's certain types of nerve blocks that can actually cause weakness in the muscle and muscle atrophy. That's counterproductive because our goals are to treat not only your pain, but to also keep you functioning at a very high level. You can only do that if you are able to strengthen the tissue that's been chronically weakened. Causing progressive muscle atrophy or weakness with some of these nerve blocks is actually counterproductive when it comes to a regenerative medicine treatment approach. And lastly, there are also certain types of injections for things like knee and shoulder osteoarthritis, such as gel injections, that can be beneficial, but the evidence shows that platelet-rich plasma, which is really sort of your baseline, first-line regenerative medicine treatment, that's actually preferential and better than the gel injections when it comes to head-to-head trials. And so that's an example of where I think if you have an expertise and focus on regenerative medicine, there are treatments that you really should be avoiding when it comes to patient care, or treatments that can actually do a better job when it comes to patient care. Thirdly, image guidance. Some physicians utilize it, some don't when it comes to their injections. I strongly believe that you need to be using a combination of high-level X-ray and ultrasound guidance when it comes to injecting orthopedic tissue. I say that very passionately because having done these injections blindly, meaning just utilizing palpation, I can tell you there's a huge difference when you're utilizing very high-level expertise with ultrasound and X-ray guidance. Until I personally develop X-ray vision, I will still be utilizing the tools that are available to me, and that includes combining ultrasound and X-ray guidance. And the reason why is because it's not good enough to be injecting close to where you have a problem. I want to be injecting exactly where you have your problem, meaning exactly where you have your damaged tissue. If you're able to utilize a high level of image guidance, you get not only a better delivery of cells to where you need them to go, but you also get a better result as well. And you can also treat tissue that would otherwise not be able to be treated, whether that's a very fine tear in a rotator cuff tendon or a ligamentous tear like an ACL injury in the knee. Furthermore, a personalized care approach is essential when it comes to these treatments. What that means is if you have a tendon injury versus a muscle injury versus a nerve injury versus a joint problem, we're going to utilize different platelet preparations, different stem cell preparations to get the right kind of effect. That's important because most physicians are currently utilizing what's called a kit-based approach to treatment, where they may do a blood draw or a marrow draw and get the same kind of end result product regardless of what your issue is. On the other hand, what we utilize is a lab-based approach. And what that means is that we utilize a lab in the office to specifically prepare your cells in a manner and concentration that is most appropriate for your condition. That's more personalized and more specific to your condition rather than utilizing a one-size-fits-all approach. You'll get a better result with a personalized approach. And lastly, and incredibly important, is having a comprehensive approach to treatment. One thing that you'll notice with our evaluation process is that you may come in with, let's say, one problem, let's say a knee issue, but we'll be evaluating more than just your knee. I'll also be evaluating your ankle, your lower back, because those are all areas that'll affect what's actually causing your primary issue. If you don't evaluate those other issues, you're not going to get as good a result. Now that may lead to a recommendation of focusing some biomechanical or physical therapy changes in those other areas, but sometimes it'll also lead to me recommending treating those other areas with some of the regenerative medicine treatments as well. It'll give a better result than if you only look at that one area that's problematic. The body is a very finely coordinated and complicated machine. And if you look at it with only too narrow a focus and not a total 360 process and approach, you're not going to get as good a result. In that regard, when it comes to treatment, when we're actually injecting, it's important to treat the entire area that's pathologic and comprehensively. And that requires an understanding that musculoskeletal conditions have a layers and layers of depth of pathology that needs to be treated. So if you have, let's say, arthritis in the knee, it's not good enough or appropriate to only treat the knee joint. You have to look at the other layers of tissue that are affected as well. And that would include the meniscus, the ligaments, the tendons, the muscles, the fascial layers, sometimes, and if needed, also even the nerve and bone areas that could be affected as well. That comprehensive approach makes a huge difference in terms of results because it's not just that one tissue layer that's causing your pain or dysfunction, it's all those other areas. Again, our goals are to maximize and optimize pain relief and functional improvement. You do that by taking that more comprehensive approach. I hope that gives a better sense for the kind of care that we're trying to provide and how we can approach care. I look forward to meeting soon. Have a good day. Live well. Bye-bye.